Diabetes continues to be a major concern for us here in Belize. Statistics from the Ministry of Health is stating that approximately 70% of our population is living with diabetes, and that is a concern.
The medical condition has resulted in frequent amputations at the Carl Houston Memorial Hospital. KHMH Chief of Surgery, Dr. Jose Moguel, says every month at least 3 patients lose a limb because of their diabetic status.
It starts as simple as a sore, maybe a trauma. A diabetic person might bump his toe or an area of the limb, and then it would get infected, and from there on it progresses into a limb-threatening condition.
4 years ago, 73-year-old Jane Young lost her left leg after a cut on one of her toes did not heal. By the time she sought medical attention, it was too late.
Well, I tell you, I was so upset. I cried. Well, they were going to take off my foot. Won't you cry?
Diabetes has not only affected Young's health, but it has taken the lives of 9 of her brothers and sisters. Today, she resides at the Sister Cecilia Home for the Elderly, where she gets around by wheelchair.
I think we're having too much amputation in Belize.
It's a crippling situation that has caused the Ministry of Health to seriously embark on a new countrywide educational initiative to be implemented in September at all health centers and hospitals. The program is designed and coordinated by U.S. veteran podiatrist Dr. Neil Donohue.
All we're doing is going to create a totally positive atmosphere for people with diabetes to take responsibility for their disease. I mean, I still have people at home in the U.S. that come to me and they say, oh, my diabetes is my doctor's problem. Well, it's not your doctor's problem.
Donohue says the program involves a participatory approach in getting not only families but whole communities to change their lifestyle. Donohue says he knows it will be a challenge, but all parties have agreed to be a part of the process.
We are trying to do something very difficult. We're trying to change people's behavior. We're trying to change ways people have lived all their lives. If they're overweight, we need to think about them wanting to have a healthier lifestyle. We're not only educating patients with diabetes, but we're going to be engaging their whole community around them, their families, their friends, even at home, ways they can be reinforced at home to begin to live a healthier lifestyle. And getting into that health center or clinic on a regular basis to have their diabetes looked after, to get their foot examination, to get proper shoes, proper insoles, and proper ulcer care if they do get an ulcer. So it's an integrated process. It's one where all we're doing is going to create a totally positive atmosphere for people with diabetes to take responsibility.
Young continues to battle with her illness. 1 year ago, doctors had to remove part of her right big toe, and only 6 months ago, she started losing vision in both her eyes.
It's a very serious disease because it affects so many parts of you.
Young admits that at first she believed it was only her doctor's responsibility to take care of her diabetes.
We're going to completely turn that around in Belize and say, this is a disease I live with as a patient. I am going to improve my lifestyle. I want a healthy lifestyle, and I'm going to ask my family and friends to help me do that.
Young says she will continue to fight to save her right leg, but despite whatever other health complications she may experience, she advises Belizeans to learn from her mistakes and take responsibility for their own health.
What I would like to tell them, not to eat everything. Like me, I eat everything. And it doesn't do me any good, like me. No, say that I am not going to the doctor and I am not going to the doctor. Go right now, because I didn't go right now. And this is what I got, my foot off.